Which of the following is the most common complication of femoral vein cannulation in ECMO? A. Arterial embolism. B. Bleeding. C. Infection at the cannulation site. D. Aortic dissection. Answer: B. Bleeding. Explanation: femoral vein cannulation, while often used in ECMO procedures, can be associated with complications such as bleeding, especially given the large diameter of the femoral vein and the need for anticoagulation. The risk of bleeding is significant because of the high flow rates through the cannula and the need to prevent thrombosis in the circuit. In venovenous ECMO, what is the primary benefit of placing the return cannula into the internal jugular vein? A. It minimizes the risk of thrombosis. B. It provides faster blood flow compared to other veins. C. It prevents blood from being returned to the heart. D. It optimizes oxygen delivery by returning blood near the heart and lungs. Answer: D. It optimizes oxygen delivery by returning blood near the heart and lungs. Explanation: placing the return cannula into the internal jugular vein allows for the oxygenated blood to be returned near the heart and lungs, optimizing the distribution of oxygen to vital organs and tissues. This configuration improves the efficiency of oxygenation and ventilation in venovenous ECMO, particularly for respiratory failure. What is the primary function of a centrifugal pump in an ECMO circuit? A. To provide mechanical ventilation. B. To regulate blood pressure. C. To circulate blood through the ECMO circuit. D. To oxygenate the blood. Answer: C. To circulate blood through the ECMO circuit. Explanation: the centrifugal pump in an ECMO circuit is responsible for pumping blood through the system, ensuring continuous circulation through the oxygenator. This allows for blood to be oxygenated and carbon dioxide to be removed, providing support for patients with severe respiratory and/or cardiac failure. Which of the following is the most common indication for using veno-arterial (VA) ECMO in adults? A. Respiratory failure with no cardiac involvement. B. Cardiogenic shock due to acute myocardial infarction. C. Acute respiratory distress syndrome (ARDS). D. Chronic obstructive pulmonary disease (COPD) exacerbation. Answer: B. Cardiogenic shock due to acute myocardial infarction. Explanation: veno-arterial (VA) ECMO is most commonly used in patients with severe cardiogenic shock, especially when it results from acute myocardial infarction or other forms of heart failure. VA ECMO provides both heart and lung support, maintaining circulatory and respiratory functions in patients whose heart is unable to pump blood effectively. What is the primary role of the ECMO membrane oxygenator? A. To maintain the body's temperature. B. To exchange gases, oxygen and carbon dioxide, in the blood. C. To remove waste products from the blood. D. To deliver mechanical ventilation to the lungs. Answer: B. To exchange gases, oxygen and carbon dioxide, in the blood. Explanation: the membrane oxygenator is the component of the ECMO system responsible for gas exchange, providing oxygen to the blood and removing carbon dioxide. It functions similarly to the lungs, allowing for oxygenation in patients with severe respiratory or cardiac failure who cannot oxygenate effectively on their own. Which of the following is the main reason for performing ECMO in patients with cardiac arrest? A. To prevent further brain injury. B. To support circulation during chest compressions. C. To provide long-term heart failure support. D. To treat the underlying cause of the cardiac arrest. Answer: B. To support circulation during chest compressions. Explanation: ECMO during cardiac arrest serves as a means of supporting circulation and oxygenation when conventional CPR is insufficient. By providing extracorporeal circulation, ECMO can ensure that vital organs, especially the brain and heart, are perfused during chest compressions, which is crucial for improving survival and minimizing brain injury. What is a common management approach to prevent clot formation in an ECMO circuit? A. Administering blood products regularly. B. Reducing blood flow rates. C. Continuous anticoagulation therapy. D. Restricting fluid intake. Answer: C. Continuous anticoagulation therapy. Explanation: to prevent clot formation in the ECMO circuit, continuous anticoagulation therapy is used. This typically involves medications like heparin to reduce the risk of clot formation, as the blood is continuously circulated outside the body. Monitoring anticoagulation levels is critical to balance the risk of bleeding and clot formation. Which of the following would be an indication for converting from veno-venous (VV) ECMO to veno-arterial (VA) ECMO? A. Progressive respiratory failure with recovery of cardiac function. B. Sudden onset of cardiac failure in a patient already on VV ECMO. C. An increase in oxygenation while on VV ECMO. D. Improvement in renal function while on VV ECMO. Answer: B. Sudden onset of cardiac failure in a patient already on VV ECMO. Explanation: in patients on veno-venous (VV) ECMO who suddenly develop cardiac failure, conversion to veno-arterial (VA) ECMO is necessary to provide support for both the heart and lungs. VV ECMO is only suitable for respiratory support, so if the heart begins to fail, VA ECMO is required to support both organs. What is one of the major advantages of ECMO over traditional mechanical ventilation? A. ECMO provides long-term organ support for chronic conditions. B. ECMO is more effective at removing waste products from the body. C. ECMO can bypass the lungs and heart, allowing for direct organ recovery. D. ECMO requires no anticoagulation therapy. Answer: C. ECMO can bypass the lungs and heart, allowing for direct organ recovery. Explanation: one of the key advantages of ECMO is its ability to bypass the heart and lungs, allowing these organs to recover from severe failure. It provides temporary support to enable organ healing, especially in cases where mechanical ventilation cannot provide adequate oxygenation or perfusion. Which of the following is an important consideration when selecting a cannulation site for ECMO? A. The size of the vein or artery. B. The patient's body mass index, BMI. C. The patient's level of consciousness. D. The patient's blood pressure. Answer: A. The size of the vein or artery. Explanation: the size of the vein or artery is a critical factor when selecting a cannulation site for ECMO, as it determines the appropriate size of the cannula that can be inserted and the flow rates that can be achieved. The larger the vessel, the higher the flow rate that can be achieved without causing damage or compromising circulation.